So the idea behind this presentation is that we have the already existing clinical combined rounds, the CCRs, which are held on every Wednesday. And then recently we started several other combined rounds, undergraduate, postgraduate, dental, nursing, physiotherapy. And I'm very happy that as far as the scientific content is concerned, it's improving day by day. Every day we have a better scientific content. But still the structure, the format of the presentation leaves a little bit to be desired. And I thought that if I do this session for postgraduates as well as the faculty members who are interested, maybe there will be a little bit of improvement in the quality of the presentation, not the content. Content has to be improved by the respective departments, the quality of presentation. So first thing which when you make or prepare a presentation is the title slide. And here, because I'm making this presentation in our own institution, I don't have to say that I belong to Mahatma Gandhi Medical College. But some of the audience may not know to which department I belong, so that is why I have mentioned my department. Also, it's a good idea, and I do it as a routine, to give your email address in the beginning, because if there are any students, most of the time students are very hesitant to ask something in the hall. They don't want to be seen as not knowing something. They may want to correspond with you and ask you something. So I always give my email address in my presentation to let students, or if I'm presenting some kind of a research, those who are interested in the same field to communicate with me. If I were making the same presentation at a place in Jaipur, then I would say that I am from Mahatma Gandhi Medical College and Hospital. If I am making the presentation outside Jaipur or in another state, I would say that I belong to Mahatma Gandhi Medical College and Hospital. Earlier, as you saw, I just mentioned MGMCH, because I expect that most people, most audience in Jaipur would know what MGMCH is. But if I'm going to Karnataka, they may not know what MGMCH is. So I mention the full form of the institution and I say Jaipur. If I go and make the same presentation in Japan, I would just say India, because there I'm representing my country. So even the title slide has much to convey, and it has to be made with care and caution. There are three major types of communication, scientific communication. One is written, that you publish something in a print journal. Original article is the best publication. Of course, today in the hierarchy, we have the systematic reviews and meta-analysis also. But I personally still feel that original article is the one which shows your research capability. So all students, all young faculty members should aim to have an original article, first author article published. The biggest advantage of a written or a journal publication is that it is lasting. It lasts forever. Once you have written something, it is there forever. Anybody can read it 30, 40, 50 years later also. Next is a visual presentation, posters. Most societies now, international and many national also, they accept very few oral podium presentations, short papers. Most of the abstracts are accepted as poster. The advantage of a poster is that there is more time for interaction, because the posters are on display throughout the day. People can come and see at their convenience. And when the presenter is there, you can interact with the presenter as long as you want, because there's no time restriction. On the other hand, the oral or the podium presentation has the advantage that it is a direct interaction, because in poster, there is a fixed time when the presenter is supposed to be there, 1 hour or half an hour. Rest of the day, the posters are on display, you go and see them, but you can't interact with the author of the poster. Unfortunately, in our societies, most of the times we hear the sentence, sorry, we have no time for discussion. And that is because we are not punctual, we are not disciplined. If it is 8 minutes, it should be 8 minutes, and the remaining 2 or 4 minutes should be used for discussion. And that culture we have to learn from our Japanese colleagues, whether it is in general society or in science, their punctuality we all have to learn. So when it comes to oral paper, you have to remember that in the oral paper, short paper, which the students will be presenting, you have to address only one aspect of your entire experience. Or if it is a hypothesis, only one question. To give you an example, in the last more than 30 years that I have been involved with my area of interest, gallbladder cancer, we have managed more than 1,000 patients with gallbladder cancer, both at Lucknow and here. Now, it's not possible for my resident to present that entire experience. The residents want to do it. They want to say, sir, pura 1,000 case present kar dete hain. But it is not possible. It is not desirable. You have to pick up one aspect. So, for example, is gallbladder cancer more common in North than South? Epidemiology. Do gallstones cause gallbladder cancer, or does neoadjuvant therapy improve the resectability? So one aspect of that huge experience should be presented in an oral paper. So with that aim in mind, you start preparing an abstract for a conference presentation. And for both oral and poster, the structure of the abstract is more or less the same. There is a background or an introduction, why you did it. I will expand on these subheadings. What is the aim or objective of this presentation? In which patients or what did you do? The results. In the abstract, there is no discussion. In the abstract, there is no discussion. You only conclude. Some societies allow a space for references, some do not. So you have to look at the instructions. And once you've written the abstract and it is accepted, you have to prepare your presentation. Usually short papers are for 8, 10, maximum 12 minutes. In Japan, at one time when we used to go, it was only 6 minutes. So if it is a 8 or 10 minute presentation, I would suggest that you should aim for not more than 10 and definitely not more than 15 slides. And this is how you distribute. The chunk, the major part of your presentation should be methods and results, what you did and what you found. And when it comes to speech, on an average, one can speak about 100 words in a minute. So for 10-minute presentation, if you want to write it down, it should not be more than 1,000 words. And you can rehearse and time yourself. This number may be more if you have images, because images you show for a few seconds and then you move on to next, as I will illustrate. So what is introduction? Introduction is whether, the question, whether gallbladder cancer is more common in women versus men. What happens when drug A is given versus when drug B is given, or why? Why is it that gallbladder cancer is more common in North India as compared to South India? So the reason that you started this analysis or this study or this experiment is the introduction. And just for the sake of imagination, if Newton were to write the introduction of his abstract, this is what he would have written. That's all. That I observed that the fruits fall down and I wanted to know why. And that is how he discovered gravity. So introduction is very brief, why you did this analysis. Methods, as I said, which patients, what you did, how you did. If it is drug, the dose, duration, route of administration. If it is a procedure, standard procedure, you just name. If it is a new or a modified or a deviation, you describe. And if it is a surgical procedure, some societies even accept short video clips. So basically, it is what is known as PICO, population, the patients, intervention, what you did, is there a control group, and the outcome measures, not the results, but how you measured the results. And recently T has been added, which is the time duration. Results should occupy the maximum part of your abstract as well as your presentation. What you found. So what you did has to go to the methods. What you found has to come in the results. And what does it mean doesn't come in the results. It goes to the discussion. As I said, in the abstract, there is no discussion, but when you are presenting, yes, you will discuss it. So the discussion is what you found, and if others also have found same or similar findings earlier, or if your findings are at variance or even contradicting what others have reported, and the reason for that, the possible explanation for that. What is your hypothesis for this variation? And then what does all this mean? What is the clinical significance? And so what? So what means that based on your results, how others should change or modify their practice. And if you have not reached a definite conclusion, what next either you are planning to do or you suggest others to do in the same field. The summary is definitive. For example, if from our study we found that yes, large stones cause gallbladder cancer, or it could be part. We are not sure because of the numbers or because of the methods that we used, but we feel that large stones may cause gallbladder cancer. Or it could be that it is only a part. Yes, size correlates, but sorry, we didn't look at the type of stone. Maybe type is also important. So next time we will look at the type also. Or it could be a negative, that we didn't find any correlation. And why we could not find, is it the small number or is it that we did not use the correct technique? There is a subtle difference between summary and conclusion. So from this example, the summary is that there was a strong association with the size of the stone with the occurrence of gallbladder cancer. That is what we found. And the conclusion is the implication that those who have large stones, even if they are asymptomatic, because normally we advise surgery only for symptomatic stones, they may be offered cholecystectomy in order to prevent cancer. So that's a subtle difference. Summary is the actual result. Conclusion is what you make out of it. In a short paper, avoid historical background. So if I am presenting gallstones and gallbladder cancer, I need not say that the first time the relationship of gallstones and cancer was established by so-and-so in 1680 and then this happened in 1890. No, come straight to the point that there is an association between stones and cancer, and we wanted to study whether it is the size which determines the risk of cancer. There's no place for any quotations or flowery statements, and the time doesn't allow you to acknowledge. Agreed that your guide helped, your head of the department helped, your colleagues helped, your wife kept awake throughout the night when you were presenting this, but in a short paper, there is no place for acknowledgement. If I am delivering an oration based on my lifetime experience, then yes, I can spend last 2-3 minutes to acknowledge a number of people, but not in a short paper. I am saying this because I have seen students doing that, कि वो head of the department बैठे हैं वहाँ, अगर मैं उनका नाम नहीं लूँगी तो वो नाराज हो जाएंगे, but short paper doesn't allow that. So now we come to how do we prepare the presentation. Now here you see I have used a blank slide to indicate a change of gear. I have covered that what is the purpose of presentation, how you make up your plan, and now we come to the actual planning. Instead of a blank slide, here you could use an unrelated slide. You could put up a beautiful flower, you could put up a bird, you could put up your hospital's building or something, but not a family photograph, obviously. So while preparing slides, I prefer to use a white background because as you see, it keeps the podium and the stage a little lighted. A lot of people use a dark background, usually blue. I used to use blue in the beginning, but then I saw one of my colleagues using white background, and since then, more than 20 years or now, I have changed to a white background, but it's not sacrosanct. You can decide what you want to use. But if you use a light background, choose dark colors, because light colors will not show on light background. On the other hand, if you decide to use a dark background, then you should use light colors, because dark colors like red, blue, or dark green will not show on the dark background. So the color contrast has to be carefully chosen. This is one message I got on WhatsApp. We get a lot of gyan these days on WhatsApp, so I saved it. Now, I can't read what is written there, but if you change the color, then it becomes better readable. And unfortunately, this was a book given to us by a recent visitor from Germany. It's not his fault, because his city council must have produced this book. He came from a city called Magdeburg, and see, they have used a red text on a black background. Even in the book, here, I'm sure you can't read it. Even in the book, I found it difficult to read it. So color combination has to be very carefully chosen. And you look at the logos of all big brands. See how they have used the contrast? Wherever they have used a dark background, they have used a light color. And wherever they have used a light background, they have used a dark color. So please make sure that your color, because on your screen it may be visible, but to the person sitting on the last row, it may not be. A general dictum is that there should not be more than 6, maximum 8. If you want to stretch it further, 10, but not more than that on each slide. Either you reduce the text or you split it. It should not be like this. Because again, I can read it, but not everybody in the hall will be able to read it. So as a rule, not more than 8. Some slides may have more than 10 lines in one slide. I think it's fixed to a timer. I didn't correct it, sorry. So font also is very important. You look at the font options, there are hundreds of options. Some of them are very good looking, very artistic, like the first 4 lines, but they are not reader friendly. You should use reader friendly fonts. In a written text, a paper, journal, book, Times New Roman is the standard font. But on the screen, the best font is Arial. I always use Arial. All my slides are in Arial, but there are other options. These are the examples. Arial, Helvetica, and Verdana more or less look the same. Comic Sans has a little kind of flow. So some people prefer it. It looks a little more artistic, as if you have written with hand. And I remember when I was a PG, my chief, at that time, there were no computers. So he used to write it on a paper. Then we would go to the medical illustration unit, get a picture, and then there were those transparencies. Then we would mount them, and then he would brush each heading with a color, each subheading with a color. It was such a tedious thing. In the presentation, as well as within the slide, there should be consistency. I don't know how many of you can make out what is the inconsistency here. See, when it came to references, I have used a different font, Times New Roman. That should be avoided. By and large, the font should remain the same, because the eyes get set to read that kind of a font. If you keep changing it, there is stress or strain on the eye of the reader or the person in the audience. Size of the font is also important. I, as a routine, do not go below 16. The smallest font that I use on the slides is 16, which is for citation, for reference. This is my structure. You can vary it. I always use 36 for the title, 32 for the subtitle. Text usually is 24. If it is a rich text slide, I go down to 20, but not below 20 for the readable texts. Only citations are at 16. Too small font size should be avoided, because if you write something in too small font, that is only for yourself. Nobody else can read it. And I always use bold. You compare this, the first one is bold, the other is no bold. So you have a lot of space on the slide. it is always better to use bold. Big is not always beautiful. Just as when we talk to each other, we talk. We talk in an audible volume. We don't shout. And in writing, using all capital is like shouting. So you should not use all capitals. It is always upper lowercase. If you want to make a point, yes, one line, one word may be in all capital. That is when you're shouting. I want to convey a bold message to everyone that this is to be done or this is not to be done. So here I want to tell, do not shout. So I have put it in capital, speak. Same is true of all capital versus upper lowercase. The consistency of the case, that is upper or lower, is also important. Now here again, if you can pick up what is the deviation I have made, and it is that in the first two lines, both first and second word are with capital. But in the third line, methods is with the small case. There should be consistency. Either everything is capital or everything is small, the second word. So consistency of the font, consistency of the case, consistency of the color is important. You can change the color and size, sometimes font also, if you want to highlight something, if you want to project something which you want the audience attention to it. But in general, there should be consistency. You should very carefully check the spellings. It's very common. It's very common in presentations to find spelling mistakes. I mean, these are silly and funny mistakes. If you haven't picked them up, I will point out. But spelling mistake is the commonest problem in slides because you haven't reviewed your presentation. After making the presentation, not then and there, maybe after a day, after a few hours, after a week, if you have time, go through it again. You yourself will pick up the spelling mistakes. And yes, autocorrect is available. Computer allows that, but be very careful. Now, this is from PubMed. I don't know whether you can pick up what has gone wrong with PubMed. It has made a hilar cholangiocarcinoma, which is a very aggressive cancer, a respectable cancer instead of a resectable cancer. So autocorrect is not tuned to medicine. Autocorrect is tuned to general English. It makes resectable into a respectable disease. Obviously, when you are presenting the discussion, you have to refer to the literature and you have to cite references. So this, all my examples are from gallbladder cancer. So I am trying to tell you that we have done major resections. This is my mortality and this is the mortality reported in literature. So I say that when hepatectomy, resection of a part of liver is done, mortality is 18 to 24%. And when it is combined with pancreatic resection also, it becomes even higher. And I have given 4 references. Does it help you? It only tells you that mortality is high from various series. But who has reported what mortality, it doesn't tell you. So each statement, each number has to have its own reference, individual reference, not at the bottom of the slide. So if you want to go to the publication which has reported the highest mortality, 24%, you know that you have to go to Kondo in British Journal of Surgery. So each statement, each number has to have its own specific reference. You can't send letters to 10 people and write 10 addresses on a separate piece of paper. How would the postman deliver it? Each letter has to have its own address, isn't it? So that is same for references. Another example of how citations to be made. Now, this is my own slide. In the very beginning, I made this reference, and then a student in the audience came and said, "Sir, how to locate this article?" Because with this much of information, he found it difficult to search for that article. So one option is that you give the total complete reference as it is in the PubMed. You copy and paste, but it occupies a lot of space and it dilutes your content because more words are there in the citation. So what I prefer is to give a near complete citation. That means first author, the journal's name, and the year, volume, and page number, and PMID. With this, if you take a picture and you put it on the PubMed, you will definitely get the article, whereas with this, with this you may not be able to. So ideal is this, but in oral presentation, generally we don't give complete citations. I think an abbreviated citation is good enough, is useful also. Framing of the text on the slide also is important. Now, I haven't named the speaker, but this is from a national conference, an international speaker who came from abroad. And this was his title slide. Now, since this is a picture, I can't do the corrections here, so I have put it in the text form. This is how he presented: trials in colorectal surgery, what have we learned and the challenges involved. These are 3 lines. A better way would be trials in colorectal surgery, what have we learned and the challenges involved. So each line has a space, but the spacing, correct spacing is not this. Correct spacing is this. This is again my own slide, same slide as I showed earlier. But see the bottom of the slide, there's so much of space. So I can easily rearrange the text so that the entire slide looks full. Not only one half, the top half is full and the bottom half is empty. So formatting of the text is also important. And most of my slides, you will see this formatting because I don't go beyond that rule of 6 to 8 lines per slide. If you put too much text, your slide will become full. Spacing is also important, and this is another frequent kind of deficiency. Now, many people may say it doesn't matter. How does it matter? But it is like if you put on a shirt, there are 6 buttons, you can do with 5 also. But you make sure that 6 buttons are there and they are properly tucked. So same is about spacing. Now, there are a lot of problems here in spacing, which I will say. So between a letter and a colon or a semicolon or a full stop, there is not a space. Like here, after the M of duodenum and comma, between them, there was a space, which should not be there. Here, after the M of rectum and the full stop, there was a space, which should not be there. Here, between the bracket and the letter, or between the letter and the bracket, there was a space which should not be there. Between the symbol for more than or less than, there was a space which should not be there. Between the letter 5, the number 5 and CM in the last line, there is no space which should be there. So as I said, you may say I'm nitpicking, but if you want to make an ideal presentation, you have to go down to that level. A lot of people use animation. I mean, PowerPoint allows you to do the animation. It is not required. It is not desirable in a scientific presentation. If I'm making a presentation to school boys or school children, and I want to attract their attention, I may use animation, but not here. So too much of animation is a distraction. You can use animation, but only selectively and sparingly, and I'll give you an example. So when you suspect a pancreatic cancer on ultrasound, you do a CT or an MRI. If it shows a tumor, you do an endoscopic ultrasound and do a biopsy. If it doesn't show a tumor, you use endoscopic ultrasound again. So here, I don't want you to see this part to begin with, because I want you to concentrate on when the tumor is detected. And then I go on to when tumor is not detected. So you can use animation, but only selectively and not something like this. This is too distracting, too irritating to the eyes. Now, as I said, results form the major chunk of your presentation. But there is a difference between how you describe or show your results in a written paper versus an oral presentation. Tables are very good for written paper. This is from our own paper. But if you put this table on a presentation, even I can't read it. I don't think you can read it. Even if I want to enlarge, because the table is so big, either I will lose the rows or I will lose the columns. So tables, by and large, have no place in an oral presentation. They have a place in a written paper, in a poster presentation. By and large, you should use pictures when you are showing results in an oral presentation. Bar diagrams, curves, pictures, illustrations, very little text, more images. So this is how a picture. Now, this is a picture from my own book, and I have just copied and put it here. Can you read the legend? You can't. So don't just copy and paste. Rewrite the legend, as I said, in minimum 14, 16. I don't usually go below 16. This probably is 14. How you place the picture also is important. Now, see here, it is eccentrically placed. There is more space on that side. If you are using a single picture, it should come in the center of the slide. If you are using two, then you can use that option. If you put a picture and you are showing something, now I am trying to show you that on CT scan there is a nomental deposit, but can you see it? Can you see the enlarged node? Can you see the parietic node? So when you want to point out something, use arrows. You should always use arrows, write a small legend and try to highlight that. Of course, you can use the pointer also. Sometimes we want to reduce the size of the picture. It is in the JPG in my folder. I have pasted it and then I reduce the size. But reduction of size and formatting are two different things. Here I have distorted the image. The correct formatting has to maintain the original shape, which means you have to drag it from the corner, not from the superior, inferior, or lateral border. If you do drag it from there, the picture will get distorted like this. Whenever you show a picture, the confidentiality of the patient has to be maintained. Now here, you can read the name of the patient. That is not accepted. That is definitely not desirable. And you must either cut it off. If it is not possible to cut it off, you should blacken it so that it cannot be read. And no identity of the patient should be revealed in any public presentation. If it is a departmental audit, which is a closed door meeting, yes, their patient's identity is important because everybody wants to know in which patient this complication occurred. If you take pictures from any other source, and purists will say even from the internet, you must cite the reference from where you have taken the picture. Obviously, if you are using somebody else's work, you must say that this picture is not mine, this is from this source. And unless it is a free image available on the internet, even the internet source preferably should be mentioned. I want to show you a video. It's not running. This happens very frequently, especially if surgical technique, lab technique, or a procedure. You must always have the original video file in a folder. If it doesn't run here, you reduce the PowerPoint presentation, open the original file, show the video, and then come back to your PowerPoint presentation. So that brings us to how to present. Now you have your abstract accepted, you have prepared your presentation, how to present it. Always carry your presentation, especially if you're going to a prestigious meeting, in 2 pen drives, one with you, one in your bag. Best is to email it to yourself or put it on your Google Drive, send it to the conference organizer. Even if you lose your pen drive, it is there as a backup. And as I said, for videos, the source file should always be there with you in addition to the hyperlink. And if you are traveling abroad, never keep your presentation in the cabin bag. It may get delayed, it may get lost, and your presentation is the very next day. Keep it in your check-in bag. Sorry, the other way around. And this picture I always show, this is one of the very senior surgeons, Dr. Utwadia, who was associated with our university also. He passed away recently. Such a senior person. He has gone to the preview room. He's looking at his presentation again, and if there are any mistakes, he's correcting then and there. Unfortunately, in this case, when he came to the podium and started showing his videos, the video did not run, although it ran in the preview room, but fortunately he had the backup file. And before you start your presentation, you must familiarize yourself. If it is a new place, suppose you've gone to a conference, how and where the podium is. If you are short height, you've seen so many times in the auditorium that for those of us who have a short height, they put a pedestal. So if you are a short-heighted person, you must make sure that there is, otherwise I will be standing like this. Nobody is able to see you. And you must get familiar with the pointers, with the mic, with collar mic, and everything. In the text, in a journal article, you can read at your own speed because the text is there. It doesn't change. But in an oral presentation, you have to follow the speed of the speaker. And in an oral presentation, as opposed to a visual one, visual means poster or text, all the text which is to be spoken should not be put on the slide. And you should not just be reading it out, because the audience can read it before I can read it. And I'm sure the same thing happened with you. You must have read the entire text even before I could read only the second paragraph. Because when you are reading it aloud, it takes more time as compared to when you are reading it in your mind. So this is again a very basic dictum. Don't put everything on the slide. If you are a new presenter, have it with you on paper and read it from there, but not from the slide. Because the other problem is then you are facing the slide, you are not facing the audience. At all times when you are making an oral presentation, you should have an eye contact with the audience. In scientific presentation, as opposed to a literary, you should not be a Shashi Tharoor. He sounds very good. He's good for Jaipur Literature Festival. But in a scientific meeting, you have to use simple words, technical words, short sentences, and active voice. Active voice means we did this, we found this, we think it is this. And if you are a beginner, you should always rehearse. These days I don't, but till almost 5-10 years ago, I would always, I used to have a dictaphone, I would always record my presentation and then listen to it and see where I went wrong. Maybe I should start doing it again. In a scientific presentation, if you are delivering a short paper, a lecture, there is no place for dramatics, or I wouldn't name, but a lot of times now on TV you see a lot of dramatics and a lot of histrionics. But unless you are delivering a light-hearted kind of talk, a funny talk, or an oration where it's semi-scientific, then maybe I can do this. Yeah, what do you think? But not in a scientific presentation. Scientific presentation is a serious business. Your body language, your posture, how you stand is also very important. It should not distract the audience, your movements. Volume, neither too low nor too high. Speed, pauses, breaks to highlight, repeating things to emphasize points. All this is very, very important. The volume, the speed, and the pitch is like making it capital, making it italics, underlining it in the written text. So when we want to highlight something, we do that in the written text. In verbal presentation, you do it by modulation. This should be avoided. You should not. When you are making a scientific presentation, maximum this, best is this. If you want to attract the attention of the audience, you may use your hands, but not like many politicians do. So in a sense, slides should not be used like crutches that you can't walk without them. If you are physically disabled, you have to use crutches, but not otherwise. So they should be like a walking stick. You should be leading others with the help of slides, with your presentation, with your speech. So if you have bad signs, I won't say bad, but not so good signs, maybe I'll change this. It's difficult to get recognition just because you're a good speaker. That is not possible. But Unfortunately, many a time, good science, good work doesn't get recognition because your communication skills are poor. So you have to have good science, but on top of that, you have to be a good communicator also. Oh, sorry, my presentation has finished. Thank you. So that should not happen. Suddenly the screen should not go blank and then you realize and audience realizes that your presentation is over. You should always have a last slide which tells you and the audience your presentation is over. Last slide is also important. For a resident, just a thank you is good enough. When I go and teach students, I again give my email address, my website, so that if they want to know more about me or correspond with me, they can do that. I can show the picture of my institution to advertise my place of work. If I'm going outside the state, I can show a beautiful place in my city and add my email address to this. When I go abroad, I show this picture. But to you, sometimes I use the opportunity to announce a meeting that we are going to organize. So this is the meeting which this year Dr. Bushra and Dr. Pragati organized, and next year we are planning to do it again. And for my young colleagues here, this is a book which is for surgical students, but there are a few chapters which may be of use to any student in any discipline. So if you want to read those chapters, send me a mail, pkkapoor.india@gmail.com. Just write Pearls General so that I know that you want the general chapters. I'll be happy to send you the soft copy of those general chapters, which will help you to know how to answer questions in a clinical or a practical or a viva voce exam, and how to present history, how to present examination. So once again, thank you all who have come for this presentation, and I would like to thank Dr. Nitin for agreeing to chair this session, and to some of the senior colleagues who have come, and all the other faculty colleagues and students. Thank you very much.